What's up, friends? Welcome. It's time to elevate and thrive. And for those athletes out there that are dealing with an injury or want to prevent an injury moving forward, we have the show for you. It's your host, Barry Napier, here with Dr. Angela Yeagley.
Hey, y'all.
And today we're going to get into some of the most powerful treatments to help people speed up recovery when they've encountered some kind of an injury. And this one's a little bit pointed at athletes, but that's a broad term we're using here, athletes. I mean, that's anybody who does anything physical. You're an athlete in terms of this podcast.
Yeah. You're exercising, you're moving, you're wanting to move, right? And we're focusing on if you get injured, like how can you approach that? How should you approach it? And what are some other, maybe what we would consider more natural therapies to speed up your process?
Totally. I think one of the big challenges just right out of the gate is when you have some kind of an injury happen, it can be hard to know when you should go get help, right? So I always like when we're dealing with these injury kind of topics, part of it is like, well, when should you get help? Sometimes you know right away.
Yeah, you're in extreme pain. You're not getting better.
You're in extreme pain.
Yeah.
Your body makes a crazy sound like a pop or you scream out loud.
Right.
Yeah. That's usually the sign that you're going to need to go get help from some medical professional at some point in the very near future. That's what happened to me semi-recently when I tore my pec muscle, partial tear in my pec muscle. I screamed with lots of profanities.
Yeah.
I heard it pop, right?
You had lots of unusual sounds coming from your body.
Exactly.
Yeah.
A lot of times for those of us who are doing any kind of working out, whether that's CrossFit or you're an industrious or even just at the regular gym. I was at the home gym when I hurt myself. When something like that happens, you can tell right away.
Yeah.
It's like you've had experiences with like your low back or your shoulder where you like knew you tweaked it.
Yes.
Right in the moment. You're like,
exactly. I was lifting, and then knew like after I was done, like, oh, that doesn't feel so great in that area now.
Exactly. So if you're in that category where you immediately know, it makes the decision easier. But we definitely want to recommend go get help, go find a professional. The
Absolutely.
sooner the better.
Yeah. I mean, if you bump yourself and you're like, oh, the next day I feel better, and the day after that it's even better, you're probably fine. I mean, we all do those things, right? You have a bruise, but now I would say, if you're going again, it's something extreme. You're skiing. You fall, you hear a pop, you run into something really hard, you have a massive bruise, you can't use the area anymore, or there's a lot of pain with you.
For multiple days.
Days.
And that's where it's like if it's day 3, you're popping Advil, aspirin, you're in tremendous pain. You don't have full functionality. If a person said, hey, can you do something using that body part? And you're like, no way.
Yeah.
Then it's like, go get help at that point. Because what you really need to know is what's going on, what are you dealing with, and then you need to plan to get yourself on the other side.
Exactly. And you likely, unless you're in the medical field and you deal with these things, you're not going to know like the plan that you're going to need to be on. I mean, you could guess. You're like, oh, I probably should put some ice on it.
Exactly.
You need, there's a lot of things you can do to speed the process along and make sure that you heal well or that you get the appropriate care.
Yeah, you might ask Dr. Google, and Dr. Google is going to give you all kinds of different answers, right? But that's where it's like, come see an actual medical professional. So you can start to get on a personalized plan. And what we're going to take you through today are some of the therapies that we love to deploy to speed things up. One of the first ones I think we should get into and talk a little bit about is Prolozone Therapy, trigger point therapy. Those are one of those ways that we look at if you have, say, chronic sore muscle tightness, impingement. This is a therapy we might look at for you. So why don't you tell us a little bit about what it is?
Yeah. So first, I just want to say, you're injured, see your primary care. Likely you're going to get referred to some sort of specialist, orthopedic doctor, or, further imaging to kind of confirm, or like take out, the possibility of a tear or something like that. So you're going to get a diagnosis somewhere. And so maybe it's tendonitis, maybe it's a tear, maybe it's a sprain, strain, or even a break. I mean, So Prolozone is one of the therapies that I would incorporate in addition to. So what I recommend is that they are in touch. Maybe they've been prescribed physical therapy. They're doing that. Maybe they're seeing their, chiropractic or, what I liked, holistic chiropractic, like head to toe. You have a team, right? So we are doing these extra therapies in addition to you also being supported by your team, right? So Prolozone is something that we would use. It's an injection, and it's a combination of, I like to put B12 in there for healing, but it's lidocaine or procaine. Sometimes we'll use dextrose as well, in addition to oxygen. So a form of oxygen that actually will speed healing of the tissue, will drive regeneration, will actually, in the moment, actually decreases pain, and will push the repair of that area, much, much faster. And what we found in the studies, and this is the same with PRP, the area of injury has better long-term function when you incorporate that compared to not doing any therapy at all, besides like your standard PT and adjustments, things like that. So you're going to get a greater benefit, faster recovery. So say, for instance, like you have a tear, you have a tendonitis. What I would do is first we numb the area a little bit, with that procaine or lidocaine, and then I inject ozone into it, which sounds kind of odd, but it is absolutely safe to inject a gas surrounding the area.
Yeah, I've had the ozone, I've had the Prolozone treatment a number of times. It's great, virtually painless, very, very fast. Definitely can feel it. It feels a little strange because you have like a little bit of gas.
Yeah, you have a little gas bubble.
It's like you're like a little bit of weird spot bloating there or whatever. It's like, but it goes away pretty quickly, and it's definitely something to look at when you have a really targeted area that you want to create some localized healing in, and you want to do it in a quick manner and maybe a little bit more accessible or a little more. It's a little faster, say, than doing like PRP in that area, which requires additional steps.
Yeah,
an additional
that's bigger. And I did want to mention, like, for instance, I had an Ironman triathlete who it was sent to me. He was seeing all the people. He had, the great team at head to toe. He had his PT, his ortho doc, and he had a plantar fasciitis that he could not shift. So he was doing all the things. And he was still preparing. He had stopped running, but he was doing the other things to get ready for the Ironman. And so what we did is I actually did IV. We call it MAH, but IV ozone, and that's just you mix it with blood. Anyway, we did those, and I did injections in the foot. I injected the plantar fascia. So maybe that's not the most fun injection, but it's pretty fast. It's simple. You numb pretty quick. And so we did all of that. And what was really cool is that not only was he able to go, we did 3 treatments, 3 of each of those. Not only did he go and make it and was able to run and perform, but he outperformed his previous years, which is crazy considering that he hadn't actually been training and running. And he was in his late 40s, so it wasn't like he was 22 and you have you're still growing and healing, right? He was 49, I think, and so. It was amazing. And part of that likely was like some overall body healing from like the IV as well.
Yeah, it's incredible. Highly effective therapy. Definitely one of the things we might recommend if you were to come in, say, and we're working on your own personalized plan. And a great way to think about everything we're talking about here is part of a plan we would create to help you achieve your goals. And so this is a great example with our Ironman athlete around how this was incorporated into other stuff he was doing. We were a part of that. Sometimes we're managing all of your care. Other times, we're working with a healthcare team that you've built or that we would recommend that you also bring on board to help you get to the place you want to be. That's an awesome story. Let's talk a little bit. I mentioned PRP as another type of injection, platelet-rich plasma. So this is tapping into the power of your own blood. Let's talk a little bit about that. We've talked a lot about PRP on other shows. So if you've caught any of the other shows or any of other content, you probably have heard about it, but PRP, it's an incredible way that you can use your own body's regenerative powers.
I know it sounds very strange, doesn't it? Like we're pulling blood out of your body, we're pulling the platelets and plasma out of it, we're activating them, and then we are really injecting them anywhere that you have injury or dysfunction or pain, and that is literally anywhere, right? I mean, it can be in
your eyeball.
Right. Yes, I would not do that. I just had a recommendation for a patient to have her eyeballs injected with PRP. So, yeah.
So this is an inside joke because every time Angela says you can inject it anywhere, I come up with a new place that I ask if we can inject it there.
Usually
it's so far the answer's been yes. I haven't found a no yet, but don't worry, I'm going to keep asking.
Yeah.
They're going to get even weirder now. They're like,
I'm ready. Okay. So yes, you come in, we it's a little bit of a process that, you need to spend some time here. It takes like an hour to process your blood, a little longer. And then, but what's really cool about PRP, so this has been around, at least in use since the 80s. And right now UW does it. Swedish just added it on. I mean, all the major universities have it. So it might sound a little odd, but actually it's a very tried and true therapy with a lot of clinical trials at this point. So it's a study evaluating like muscle strain, significant muscle strain in athletes. And what they found broke them up in two groups, that the athletes that had PRP injected into the area not only recovered significantly faster and returned to play significantly faster, but the possibility of recurrence of an injury was way lower in the athletes who did PRP, which I think that is just so cool. And again, it's your own blood, right? It's
Super
your
well
own stuff.
tolerated. Yeah. So this isn't something where there's a risk of rejection or something, where we're bringing in some kind of a foreign body. This is your own body's regenerative power that's just been honed and focused.
Yeah, absolutely. So great therapy to add in, especially if you've, we can use it acutely, and we can also use it if you've been dealing with something for a while and it's just not changing, but you're months out.
Yeah. So if you have a chronic issue that's, that's been bugging you for a long time, this is something we look at. This is especially useful for, if you have that sore knee that gets really, really irritated, that might be pre-arthritis kind of going on, or some, you've had surgery in the past. And so you have an area like a knee or a shoulder or whatnot that is just periodically flares up. PRP is oftentimes the direction we're going to go. In that situation, we're going to recommend we explore PRP therapy, because it can really help with those chronic, longer-term degenerative or post-surgery problems people have.
Yeah, absolutely. Yeah, definitely. We're not really mentioning too much, joint like arthritis and degeneration, but absolutely, if you have chronic, joint issues, we can stick that PRP in there. Right?
That's an issue for a lot of like older athletes that get into their 30s, 40s, and 50s, especially if they've had some knee reconstruction repair. They can start to develop a lot of knee pain, knee swelling, knee irritation. So this would be something to look at. Now, we're going to switch gears a little bit. We're going to talk a little bit about some of the other foundations. And one of the things that we should mention, and it's kind of a known thing, but we definitely should mention it, is also around the importance of vitamin supplementation, right? Ensuring baseline nutrition is in place and filling in the gaps in your baseline nutrition with some targeted vitamin supplementation.
So there's top ones. I mean, I recommend a lot of different vitamins for a lot of different things, but I would say the top ones that I would say, if you've had an injury that I want you on collagen. And, ideally we'd have some sort of, I prefer like a grass-fed collagen. It's great. But collagen in general is great. Maybe at least a serving or two just while you're in the process of repair. I would also recommend high-dose vitamin C, and you can do that orally to bowel tolerance, which means that you take enough to where it makes you poop, essentially, urgently, and then you're at your max dose, and then you do 75% of that. So that's kind of like how you figure out what your max is, like when you have to poop, and then again, your body's like, hey, I'm full, I'm good now. So the reason why that's important is vitamin C is an essential element for repair of your connective tissue. And whenever you have an injury, you're going to have a huge spike in need. Your body's going to it'll take anything, and try to put it in that area. And so it's going to be pulling from your stores, and most people get depleted pretty fast. So I would say when I have people do that challenge, most people don't have that, max reaction until about 10,000 milligrams. But I've had people get up to 60,000 milligrams before they actually have that bowel flush. So that means their body was using, up to that point, all of that vitamin C to repair.
Used. Yeah, they were in a massive deficit.
Massive deficit. So, okay, so the vitamin C, and then I do like some really good antioxidant blends. So like orthomolecular Mitocore really has a combination of glutathione precursor, a bunch of other antioxidants, resveratrol, something like that, L-carnitine for energy for the cells for repair. So I'd want a combo like that as well.
Yeah, our caveat with vitamins is that they're one of those things that can be incredibly beneficial and useful. They can also be a complete waste of money and actually work against your goals if you're taking the wrong types of vitamins and the quality of vitamins. So we definitely have a caveat around this, is like we want to help you make sure you're getting the right quality of vitamins, and then also the right targeted types of vitamins that are really the ones you need, not just a shotgun approach, because there's just so many supplements out there.
So many.
And there's so much conflicting information. It is essentially impossible to know, well, what should I be taking and not taking? Because you can read 1,000 articles and get 1,000 recommendations from 10,000 different sources, And next thing you know, you have all these, like, I don't know what I should be taking. That's where we can help and do help to create a personalized plan. Now, with vitamins, oral vitamins, they're great, but there's a superhero version of that. There's an upgraded version, and that is, of course, our IV nutrient therapy, our IV vitamin drips. This is one of our absolute favorite for athlete recovery, for lifestyle optimization, for baseline health maintenance. IV nutrient therapy is incredible. Let's talk a little bit about some of our favorite types that we like to use for people who are in recovery mode.
Yeah, you are absolutely right. I mean, we probably, if we're looking to optimize, we always want to bring in the IV vitamin therapy. One, we know that, of course, you're going to absorb some nutrients through your oral, digestion, but it's not going to be 100% versus like if we inject it or we do IV, it's 100% in. And the cool thing is that we can do very high doses that are very well tolerated to really push those healing systems of the body that you just can't do orally because your gut is going to react. It's again, thinking the last thing we talked about. So number one, I would say high dose IV vitamin C for sure. So we can get past the gut is not the rate limiting factor, right? So if we do, say, 50,000 milligrams of vitamin C in an IV, you will have no bowel issues. It does not react like that. Your body will just take that and move that right to the tissues to repair.
It's a little bit of a biohack, right? So we can bypass the gut and really supercharge from a nutrient standpoint and kind of supersaturate.
Yes, absolutely. So, and when we're doing C, actually, we include the other vitamins just because, all vitamins, they really synergistically work well together. So your Bs and your other minerals also very important for that healing process, right? So
we talk about IV nutrient like cocktails almost, is when you'll see that this Myers cocktail, and it's kind of that reference to you take synergistic elements, you blend them together, and you have something that, is better than the sum of its parts, essentially.
Yes, well said.
Just like a good man had.
Right.
Okay.
That's good. Yeah, for that.
That's where it comes from. Let's talk a little bit about IV NAD. That's one of our. Obviously, that's a very trendy topic right now. There's a lot of hype around NAD, depending on who you're talking to, listening to, especially in the anti-aging category. But we love it for healing, regeneration, and kind of stamina endurance as well.
Yeah. So NAD is a version, it's the energy molecule version of vitamin B3, right? So it's a B vitamin. However, if we look at our cells making energy, NAD is essentially what our cells make to give us energy throughout our body and, how we live. So whenever we give NAD to the body is going to take it and going to push system. It's going to really optimize every system. So that includes your repair of your injury, right? So, but the cool thing about it is that you're going to get benefits in every other area of your body. So there's going to be detox benefits. There's going to be brain benefits. There's going to be, healing of your other systems. There's going to be improvement of actually your function of all of your muscles and, related to, say, your training or your PT.
Yeah, you'll fire faster. Your synapses work better, more coordination, agility, power output. All of these things increase on that.
And it's so fun. And it feels amazing. So that's maybe like the overarching, caveat of just it's incredible. It feels incredible.
Yeah, it's the one that for sure you should do.
Yeah. For sure.
Almost everybody should do it.
Yeah.
The other one that we also love, as equally to IV NAD as we also love glutathione as well.
Glutathione is it is actually called the master antioxidant. It's like the best, the pinnacle of antioxidants is glutathione. And absolutely when you're getting in an IV, it also feels incredible. And has just a wide range of other benefits as far as improving or, healing and also calming your nervous system. So if there's nerve injury, this would be a great one also to incorporate into the therapy, right? Even if, say, you were just doing IV glutathione, which we can do any of these individually. They don't have to be together.
Okay.
But I do like it. I like it as just an incredible antioxidant. In addition to, if we can get those other vitamins, the C and the NAD and the glutathione, that's like the trifecta, right? It's the IV trifecta.
This is just one of the many but very powerful tools that we have to help you get into a spot where you can do the things that you love, feel your absolute best, and recover faster from an injury you're dealing with, or like that study that we referenced earlier, prevent some injury from happening again. So if you're dealing with a chronic issue and you really want to give yourself some insurance, protect against future re-injury, these are some of the treatments we could look at. As always, this comes down to you as a beautiful, sweet, gorgeous individual, and we're going to customize all this to really fit the gaps and the needs that you have. In some cases, we might do all of this stuff over time, not all at once. In other cases, we might just need one or two of these therapies used in a very targeted and specific manner that can produce some really incredible results. So the next steps is, if you're interested, if any of this resonates with you, book a consultation, come in online, let's chat, and we can start working on what that plan might look like for you.
Yeah, absolutely. I mean, I definitely want to hear all, exactly what you're working on, what you're needing, healing from. And then we can absolutely personalize it based on just your your ability to be here. Maybe you can only come in a little bit. Other people are willing to, they're like, I'm here. I'm going to be here once a week for 8 weeks. That's right. So, I would love to see you. Please reach out. Don't suffer in pain. Don't let the injury, process take longer than it needs to. So yeah, come see us.
We're here for you. Thanks for being with us on the show, and we will catch you on the next episode.
Bye.
Bye.